Thank you for being with Graceful Aging. We're here with our guest, Dr. Dennis Sugrue. Dr. Dennis Sugrue is a clinical sex therapist. He works at the University of Michigan. He's in private practice. He's written a wonderful book on sex matters for women, and he also has a wealth of knowledge for men. And we're going to talk about men and sexuality and some couple issues with Dr. Sugrue. Doctor, thanks for being with Graceful Aging today.
Thank you.
So, we've talked before, and I've got some different questions for you of how does a man kind of regain the interest in his wife sexually? It's been a moribund relationship, let's say, for so many years, and he wants to kind of rekindle the fires. What does a man do to figure out why he hasn't been performing or how he needs to perform differently?
Well, there's kind of two sides to that. One of the things that we do know is that aging certainly has an impact on the male body, probably far more dramatically on men than it does on women. And probably one of the biggest challenges is erectile response. As men age, with each decade, we see a higher and higher percentage of men that have difficulty with erections. And as a result of that, for many men, they decide, you know what, why bother even trying? And they'll pull back. Now, meanwhile, the woman will say, I want to be close. I want to be intimate. And the guy keeps kind of pulling back because he figures, if I can't have an erection, why bother? And the woman will say, all those years when you could get an erection, times I wouldn't be able to orgasm, but that didn't stop us, did it? Or it didn't stop you from wanting to be sexual. Let's be close, let's touch, and so forth. So one of the things that we find is that as men get older, their bodies change probably far more dramatically in terms of capacity to perform, as is the case for women. So we really encourage couples to talk. We encourage couples to start to redefine what does it mean to make love? And it's not always have to be intercourse.
If a couple comes to you with that type of issue, how long of a therapy session or series of session is that on average before things start to turn to the positive?
Typically, much more rapidly than you would think. Part of it is, a lot of times therapists, when they're working with couples with sexual problems, rather than spending months and months and months going through childhood trauma and all this kind of stuff, usually what we do is we try to hit the ground running, and we try to give the couples homework exercises. We'll send them home, getting them to talk, getting them to maybe go through a simple exercise in the privacy of their home of just getting undressed and holding each other, or perhaps giving each other a sensual massage. We'll try to help them to redefine what it means to be physical with each other without it always having to be intercourse or penetrative sex. And as a result of that, oftentimes, very quickly, the couple starts to redefine what does it mean to be physically intimate with each other. We find many men who have lost their ability to get an erection, that what they're able to do is to engage in incredibly passionate lovemaking, because now it's more than just simply, all I had to do before was to show up with an erection and I'm doing my job as a lover.
Wham, bang, thank you, ma'am.
That was the game plan. What we're finding is that many, and interesting enough, there's research out there, surveys that are being done with the aging population that are saying that they're finding sex to be more satisfying in their 50s and 60s than they had in their 20s, even though their bodies operated and looked very differently and so forth when they were much younger. But learning how to really make a connection as opposed to, as long as I have my erection, I'm doing my job, and getting couples to be able to appreciate what it means to be physically intimate and emotionally intimate becomes, I think, a wonderful part of sexuality as we age.
Well, we've all seen the commercials, and so with 4-hour erections, do those come into your office? Doc, I've had an erection for 6 hours.
That's right. Well, an interesting thing, those commercials, and it's always at the end of the commercial, and you hear that voice speaking very fast and says, and if your erection lasts more than 4 hours, go to an emergency room.
Right.
And my patients will say, if I had an erection that lasted 4 hours, I'd throw a party. So, but it really is a very dangerous situation. But yes. And then you have the other commercials, very subtle, like a guy taking a football and throwing it through a tire. I wonder what that represents.
Well, it has changed the marketplace as far as the blue pill, the Viagra, and all these other variations on it. And yet the relationship hasn't changed as dramatically. How does a man who gets the script for the blue pill and now enters into the relationship where sex has been different for all these years? How do you broach that?
And that's a great question, because there's been studies, for example, that showed that the number of refills on medications like Viagra, Cialis, Levitra, and so forth, the number of refills, surprisingly, are pretty low. And it's not because the medication hasn't worked, but because the couple hasn't received any help or haven't figured out how to make use of this restored ability in a way that it gets integrated meaningfully in the relationship. So it's like suddenly the guy with his script for the blue pill suddenly is like a kid with a new toy. And meanwhile, the partner is kind of saying, hold on here, cowboy. Let's slow this down a bit. And as a result of that, the next thing we know, that prescription doesn't get refilled because it just has caused, more turmoil in the relationship than perhaps value added. So one of the things that we really encourage, including physicians and materials out in the marketplace and so forth, is how to make use of a restored ability of getting an erection, how to integrate that back into a relationship, how to be able to have a couple incorporate that in a way that we're not losing sight of the primary function here. And it isn't simply to get an erection for penetration, but it's really, at that stage of the game, it's for two people to make a connection physically and emotionally and to be able to value that physical part of the relationship. And just simply taking a pill and getting an erection does not guarantee, and we see it doesn't guarantee, that there's going to be sexual bliss as a result of that.
So is that why people go out and get bathtubs and put them outside? Is that the other part of it?
That one lingering image seems to have imprinted itself in everybody's mind. I have yet to find a couple that would be comfortable sitting in two side-by-side clothwood bathtubs, but...
for men, fear. As you age, there might be a history of heart ailments or heart attacks, and oh my goodness, I'm going to have a heart attack. I better be careful. Or maybe I have had a heart attack. How does a man overcome and deal with that fear that through the height of sexual activity, it's going to generate a heart attack? I guess, is it true?
Well, certainly, some people, their physical condition could make sexual activity potentially dangerous. But here's the important caveat. This is, first of all, a decision that should always be made with one's physician. What we find is that sexual activity, typically, for most individuals, will be kind of the equivalent of walking a flight of stairs. Now, again, getting physician clearance, but we find that even individuals who have had a significant cardiac history and so forth, that they are indeed able to resume a very meaningful, active sexual relationship with their partner. Oftentimes, there's going to be a little bit of fear, because if I start to get excited and I'm feeling the heartbeat a little bit faster,
right.
And if the individual hasn't really come to terms with their cardiovascular history, that oftentimes the person has been traumatized by. Having the opportunity to talk to a physician or to talk to a sex therapist that can help them to restore their sense of confidence and comfort in terms of being physically active. But again, always under the advice and supervision of your physician if there is a cardiovascular history.
I have read a lot in preparing for this. They always use that analogy of if you can walk up one flight, I saw somewhere 2 flights of stairs, you're probably okay, but check with your doctor.
Absolutely.
So there's so much out here in the world now with just all the sexualization on TV shows and in movies and the porn industry and the internet. Has that gotten in the way of good sexual relations for a man with his spouse or his partner, or is there some constructive use that can be made of all of that?
Well, the answer is kind of yes to both. I think that certainly how Hollywood will kind of portray sexual intimacy and so forth. Kind of the classic scene is that you see a couple together, then the next scene is you see kind of clothes strewn across the floor leading to a bedroom door, and the notion is this is foreplay for people. Well, it is foreplay for some people at some stages in their life, but that's not going to be typically what we're going to see as couples age and so forth. So there's kind of the unrealistic expectations that can be set. Same thing with pornography. Pornography, basically if you watch a porn film, you're convinced that if a man doesn't have at least a 10-inch erect penis, then obviously he should be in the Barnum and Bailey circus because there's something wrong with him. Porn doesn't help sometimes in terms of kind of setting up realistic expectations and so forth. Now, with that being said, erotica, various types of porn, some couples integrate into their sex play, and they find that it stimulates their sexual appetite, and it is value added in their relationship. So, it's kind of a two-edged sword. Some guys will watch the porn film and, kind of feel very intimidated because they can't compare, they can't measure up, so to speak. But on the other hand, if the film helps them at times just for novelty, and if you've ever watched a porn film, we're not talking about Shakespeare in terms of the script. So if we're talking about 5 minutes just to kind of get the juices flowing and then kind of write your own script as a couple, then for some couples they make great use of porn.
So if I'm a partner in a relationship and I walk in, I arrive home early and there's my partner watching porn, it's not like the end of our relationship. There could be a new beginning to the relationship. How would you address that?
Well, it's interesting when we talk about pornography that because we have everything from kind of benign use of porn that couples will use together to enrich in their relationship, all the way to, which could be a whole topic unto itself, where some individuals develop what we call a sex addiction or a pornography addiction, where they have turned to porn at the exclusion of their partnered relationship, that they find it easier to just kind of retreat into their own fantasy world and not have to face the challenges of a relationship of being sexual with a partner. So it runs the
whole spectrum.
Absolutely, absolutely.
Well, we have to talk about HIV and STDs and condoms. We had some slides at the beginning of our program about that. Does it exist? Is it a risk? I think we all know the answer probably.
Absolutely, but and especially as we talk about the aging population, us baby boomers, the notion is that we're safe because we're older, we're kind of out of the mainstream and so forth, and that is a very dangerous assumption. We're finding that HIV, one of the fastest growing segments of the population where HIV is being found, is in the aging citizenry of over the age of 50 and so forth. The notion is two neighbors, a widow and a widower, or two divorcees, and this nice gentleman down the street, they strike up a relationship, and of course, he's been married and he's a gentleman and so forth. So at our age, why protective sex? Certainly we're not going to.
He dresses clean, his nails are clean.
That's right, and I don't have to worry about pregnancy at this stage. And, but the problem is that what we're finding is that, and he can be a very nice man with clean nails, and has lived a very virtuous life and everything else. But, you know, the old saying is, whoever you sleep with, you're also sleeping with every other person that person has slept with, and so forth. So we're finding that that becomes a concern or risk, that, as I said, the fastest growing segment of the population in terms of demographics, in terms of HIV, are folks over the age of 50. So that certainly is a concern.
So if I'm widowed or I'm alone and I want to re-enter the sort of intimate marketplace and there might be some possibility out there, should I get checked and should I carry papers and a certified card that I could pull out and say, not only clean nails, but I'm there?
Well, I think that for starters, certainly using protection. And again, that almost seems inconceivable when I talk to older couples, because the notion is we don't have to worry about pregnancy. Well, we're not talking about protection for pregnancy. And some couples that decide to enter into an exclusive relationship will still both agree to go through testing just before they do continue the relationship without making use of protection. Now, that's certainly, some people say, boy, that kind of destroys the whole romantic, kind of silver love, the gray-haired individuals that are falling in love and taking another spin on the love merry-go-round in life type of thing. But it's responsible. It's a reality today that good, decent, ethical, moral people can potentially be exposed to various STIs and all the way up to HIV. So it becomes important to be smart when it comes to that.
One more question on that, and that is, you can contract HIV or STIs or STDs. What does that mean? I mean, what does it physically mean for a person if that happens? How does it affect their life? Well,
if we're talking about worst case scenario, a sexually transmitted infection such as HIV, it potentially could be life-threatening. Other types of sexually transmitted infections can lead to cancer, for example, genital cancer, and so forth. So we're talking about potentially life-threatening conditions, which, and again, the scary thing is that we're seeing in the aging population is one of our fastest growing demographics when it comes to sexually transmitted illnesses, or infections, I should say.
Well, let's use our last minute and let's turn up the heat and turn it positive, and that is there value in your personal life to engage in sexual relations? Does it help you physically, mentally? How so?
Absolutely. And I think study after study has shown, when we take a look at individuals, for example, who have been identified as by all the markers of psych testing, quality of lifestyle, and so forth, that certainly a meaningful, robust sexual life oftentimes is one of those factors that is characteristic of an individual who's doing well. Even an individual who's not in a relationship, is not sexually active with a partner at that stage in their life, but are comfortable with their sexuality. Being comfortable with your sexuality isn't just because you're doing it with somebody. It is in touch with your body. It's the ability of being able to experience and enjoy physical sensations that your body can produce, whether you're standing underneath a shower or whether you're getting a massage or whatever, that we're tied into our bodies. So clearly, we know that when it comes to sexuality, as we get older, it becomes an important quality of life issue.
Well, you've certainly touched on that in a wonderful book called Sex Matters for Women that is in a second printing now.
Yes, it is.
Great information in here and great information today. Thank you so much for being a guest on Graceful Aging,
Thank you very
Dr.
much.
Sugrue. So we've got 7 minutes for questions. So is there a question for Dr. Sugrue?
It's a great question. That's been
So the benefit of testosterone treatment for women.
A lot of times people are told, well, estrogen is the female hormone and testosterone is the male hormone. In actuality, men and women have both estrogen and testosterone. And testosterone is, for both men and women, a critical substance or hormone for sexual desire. So there's been a lot of interest in terms of using testosterone augmentation, if you would, as part of HRT, hormonal replacement therapy, whether or not testosterone should be added to that, and so forth. The studies have been very complex, and what my personal read on using testosterone for women with low sexual desire and so forth is that those cases are typically the exception. What we find is that oftentimes there are many other factors, psychological factors, health factors, and so forth, that are making it difficult for the woman to be able to really focus on her own sensuality, her own sexual response, and so forth. So as a result of that, a few years ago, there was a big push to get women on testosterone or androgen treatment if they were complaining about low sexual desire. I think physicians have become more conservative about that now, realizing that there are certainly some cases where this seems to be helpful and appropriate, but we find that oftentimes there are going to be many psychological issues. And I'm not talking about deep-seated psychopathology. I'm just talking about life issues that by being able to address that or addressing the person's sexual comfort or body image or whatever, that we have much more success in helping individuals be able to experience a robust interest and appreciation for sex, as opposed to immediately having them start on androgen replacement or testosterone.
So page 87 through 102, 88, 216, you cover it in your book, Sex Matters for Women, as well.
Right.
Dr. Sugrue, thank you again for being a guest on Graceful Aging.
Thanks for having me here.
We have a lot of work to do, perhaps, but a lot of fun work to do to re-engage your life. Thanks for being with us on Graceful Aging. We'll see you next time.